Good day, I am Dr. K Gireesh, physician, neurophysician and neurosurgeon. This is RNA series 21. RNA means random questions in neurology and neurosurgery with answers by Dr. K Gireesh. This is to benefit the practitioners of neurosciences, neurologists and neurosurgeons, and also in the medical field for the lifelong learners, and also for public awareness. In this series, the question which I am addressing are, what are the features of single suture synostosis, craniosynostosis? Single suture synostosis, if one skull suture fuses, the condition is called single suture synostosis. The example of single suture synostosis include sagittal synostosis. This is the most common type of synostosis. It happens when the sagittal suture fuses. Sagittal suture synostosis produce a boat-shaped head that is longer than it is wide. This type of synostosis creates a prominent forehead. The child will have a ridge on the top of the head along the closed sutures. That is sagittal synostosis or scaphocephaly, boat-shaped skull. The other is coronal suture. You find unilateral coronal synostosis, anterior plagiocephaly. In unilateral coronal synostosis, one side of the coronal suture gets fused. Coronal suture is like this, one side gets fused. This causes the head shape to be uneven. On the side of the one side of the forehead will look flat. It also creates an almond-shaped eye socket on one side of the head. So that is unilateral coronal synostosis or anterior plagiocephaly. The lambdoid is the posterior plagio. Lambdoid only on one side gets fused. That is lambdoid synostosis. Is a rare type of craniosynostosis, and that happens when part of the lambdoid suture fuses. Since this suture is at the back of the head, the back of the skull will look flat. One ear may look higher than the other. The last one in this single suture synostosis is the metopic suture, which produces a trigonocephaly. This form of synostosis is uncommon, less than 10% of the cases. It happens when the metopic suture fuses. This metopic suture is at the front of the skull. Metopic synostosis can cause a triangle-shaped head. The child will have a narrow forehead and eyes that are close together. So these are the features of the various types of single suture synostosis. Primary, there is a sagittal synostosis, scaphocephaly, unilateral coronal synostosis, anterior plagiocephaly, lambdoid synostosis, posterior plagiocephaly, and metopic fusion of this. Metopic suture fusion is a trigonocephaly. That's indeed the types of single suture synostosis and their features. Thank you very much.